I had a diagnosis about 10 years ago when I went in for a physical exam, and I was not aware that I had high blood pressure at that time. So then I was immediately put on medication to lower it. I've always had, at that point, some heart palpitations, and as time went by, they were ramping up a lot. Calmness, I was robbed of my calmness. It seemed like, I just didn't have that zen feeling like, a lot of people have. I worked full time, and my children were out of the house at that point, so I didn't have a lot of stress in that situation, but it just seemed like this blood pressure wasn't going to go away. A big awareness came about at that time because of my birth family history. My birth father had a debilitating stroke at the age of 45, and he was in and out of nursing homes for the rest of his life for like 28 years. Never could work. It made me realize that I needed to get a control of my health. I realized I could be up for a major stroke, and I wanted to avoid something like that happening to me. At that point, I was just on one medication. RADIANCE posted on Facebook that they were looking for candidates for this RADIANCE-HTN research program. And immediately I was very receptive to applying for it. So I filled out the questionnaire and did some research on it. I received a call from a registered nurse the next day, and she went thoroughly over the questions again and made a decision that at that point that I could possibly be a candidate for this procedure. I have heard about clinical trials before, but I've never been involved with one that pertained to me at this point. I was called in for a conference with the cardiology team with Dr. Block and 3 registered nurses and a resident. And we went over more and thorough discussions about my health and about how I felt about going through a procedure if I was a candidate. It was very pleasant. It was not nerve-wracking, so it was a good time, and I was pleased. My goal was to get off of high blood pressure medications, to lower my blood pressure so I wouldn't have any complications with possible stroke or heart failure, and I wanted to feel more grounded. My experience with the trial has been very pleasant. The team is awesome. They're almost like kindred folk to me at this point. And I've been in the trial now for 6 months, almost 7 months. The process for me coming back from my scheduled appointments was perfect. I feel like having to come back in is a good thing for checkups because it reiterates what I've done. And my lifestyle has changed a bit because I've become aware of how important it is to take care of yourself. With this high blood pressure, there are so many issues that high blood pressure can bring. I've gotten back into my meditation. I make sure I walk and I do yoga, stretching exercises every day. I joined the study because I was very concerned as I've gotten older that I could possibly have a stroke like my birth father did at the age of 45. Also, I would like to get off of my maintenance medication drugs for hypertension. And the third thing, I thought it would be really nice to join the research team for helping others to make a decision to see if this procedure would be good for them as well. My family members were not aware of what I was doing at the time, but they've all been supportive of this. I think it's great. They think it's great. It helps not only me, but in the future, it will help other people.